Welcome to the Intimate Marriage Podcast, where I teach educated, successful couples how to have incredible, passionate relationships so that you can stop compromising and start feeling fully alive in your relationship. I'm Alexandra Stockwell, aka the Intimacy Doctor. I'm a physician, a relationship and intimacy coach, and I'm an intimate marriage expert. My husband and I have been married for 27 years. We have 4 children and full professional lives, and we've created an amazing marriage. I've shown hundreds of couples how to do so as well. So if you want to deepen your understanding of your own relationship and learn to access new heights of emotional, sensual, and erotic intimacy, you're in the right place. I will show you how. Now, let's dive in. I'm really looking forward to this conversation. All of you watchers, this is a real opportunity to hear from the one and only Dr. Sophia Yen, who I'm just getting to know, and I'll have you give some of your impressive credentials in a moment. And without having discussed it with you, I know that you have an incredibly devoted heart to serve people who may not otherwise have access to all of the equipment needed to really have enjoyable, pleasurable, relatively stress-free sex. It doesn't address all stressors, but it certainly addresses some of the most prominent ones. So a warm welcome, and why don't you please introduce yourself?
Hi, Dr. Stockwell. Thank you so much for having me here today. And I love all that you do for intimacy and partners and everybody enjoying their bodies in a safe way and minimizing danger as much as possible. That's really why I went into medicine, was that I could catch teenagers early, give them the tools to do it safely and not get pregnant, not get any sexually transmitted infections, and make sure that they get theirs. So if you're not getting your orgasm, then why are you risking pregnancy and sexually transmitted infections? And the reason I started Pandia Health, we're the only women-founded, women-led birth control delivery, and we're building the online health brand women can trust, from birth control to acne to menopause and more as time goes on. I was giving a talk to a bunch of doctors about 9 years ago. I lecture physicians on how to prescribe birth control, how to take care of teenagers, how to prevent unplanned pregnancy. And they asked, why don't women take their birth control? And one of the top reasons was, didn't have it in their hand. And my friend and I were like, well, we can solve this. We will just ship you birth control and keep shipping until you tell us to stop. And then we ran ads for free birth control, and 60% of those that responded didn't have a prescription. And it's like, don't you know in the United States you need a prescription? And as a physician, I could write prescriptions. And thus Pandia Health was born. If you have a prescription and insurance, thanks to the Affordable Care Act, any FDA-approved birth control, as long as you're not demanding a name brand when there's a generic, and know that 95% of birth control pills are generic, should be covered by your insurance thanks to the Affordable Care Act. No copay, no deductible. So free. And you pay us nothing, and we just make sure you don't run out of birth control. And we give you as much as possible, and then 2 months before you run out, we're like, go see your doctor, get a new renewal prescription. 1 month, go see your doctor. 1 week, please see your doctor now. And then if you need a prescription, we can prescribe in 17 states. It's only $30 once a year, a total steal, with unlimited follow-up questions for 364 days. Only about birth control because you only paid $30. And we have an algorithm that better serves people of Asian and Black descent than the standard of care, because as a woman of color, I realized what we were taught at the major academic institutions works great if you're a Caucasian female that wants to bleed every month. But if you're Asian or Black descent or don't want to bleed every month, we have a better algorithm for you, and it actually serves all women better. We have an 82% retention at a year for newbies on birth control versus the standard 30% or 55% that we've seen out there. So that's quite a difference. And then all our doctors are trained on our algorithm. So at 10 weeks, we do a follow-up. We're like, do you have any munchies? Do you have any zits? Do you have any breakthrough bleeding? And our doctors know how to tailor and be like, oh, okay, we need to bump this up. We need to bump this down. Let's change this one because you're having those side effects. I think no other platform out there has that. And we're bringing that same rigor to menopause. We have 2 out of 1,000 Menopause Society certified practitioners in the nation. There's only 1,000 and we have 2 of them. And we're letting all of our doctors get certified as well that want to sign up and go through all that training as well. But these 2 are leading our program and training all of our physicians to follow.
Okay, this is amazing. I have so many questions. For the most part, the people watching my channel on YouTube are not physicians, so I'm going to ask one sort of physician-y question, but it is of general relevance, and then otherwise stick to generally relevant questions. And the first one is, I'm not sure if you already answered this question when you talked about at 10 weeks checking for zits and breakthrough bleeding and so forth, but what are some of the ways that birth control is best adjusted to serve Asian descent and Black descent women?
So when I spoke to other doctors of Asian and Black descent, we're like, oh yeah, what we're told to prescribe everybody works great for a certain group. But for Asians and Blacks, I personally had to go through 3 different birth control pills, and only because I was a pre-med that had to get through med school, residency, fellowship, like, this has to work. I cannot get pregnant. There's just no way. And I cannot no longer have sex with my boyfriend who eventually became my husband, so like, this needs to work. And so I stuck with it. But some women will just try 1 pill and they're like, oh, well, the pill sucks. I'm out of here. And they don't realize that there's 8 different progesterones, 40 different pills, because there's like 2 levels of estrogen. And so just know that if 1 pill doesn't work, there are 7 other progesterones at least. And sometimes a different level estrogen will take care of whatever that side effect you have that's going on. And all I've done for the past 7 years as an academic is birth control, birth control, birth control, birth control. I've written 7,000 plus prescriptions and looked at the side effects and be like, oh, every time I do this, I get this. And so we're about to apply an AI to check like, oh, you have this. This is why our algorithm works 82%. And we want to get it up to 95, 99% that we have all your info. And we're like, bam, that's the one for you. You don't need to like mess around. And we find that 90% of our patients are happy with that drug that we start them on.
Okay, so there's something so important in what you said, which is the definition of, or what you mean when you say it doesn't work, because the goal is contraception. So if we're saying it doesn't work, it means people are getting pregnant, which is not actually what you're talking about. When you're saying it doesn't work, you mean it doesn't work for the woman to continue to take it because there are other things going on that end up taking priority over whether or not she's taking the pill for contraception.
Yes, thank you so much for that clarification. If you take the pill, it generally works. It's if you skip the pill, don't take the pill because of the side effects, such as munchies, zits, breakthrough bleeding. Older women, we see a greater effect on libido, but the 20-year-olds have so much libido that it doesn't make a difference. It's the 40-year-olds that I have issues with, mainly because, unfortunately, the same hormone that will give you zits will give you libido. But if we decrease your zits, then we might also decrease your libido. But if you have less zits, then you might feel hotter, So it just depends.
Okay. So when you went to medical school in order to treat teenagers, that's not something that typically people end up with a passion for just at whatever age you went to medical school. So what happened that has been this driving force that so many women and their partners get to benefit from, but something happened?
I think it's always been about self-interest. I was a sexually active teenager and I was pre-med and I was like, I cannot afford to get pregnant and I better have the right to comprehensive sex ed, confidential reproductive health care. But more importantly, I think you might have picked up on that I was a pre-med. I worked at Planned Parenthood and I ran pregnancy tests, and I ran a pregnancy test for a 13-year-old and it wasn't me. And it came back positive. And then I gave her options. You can continue the pregnancy. You can terminate the pregnancy. You can give the pregnancy up for adoption. What would you like to do? And she's like, I'm going to keep it. And I was like, okay. And then, referred her on to go forth with that. But how different would our paths be from that moment on? I would go on to MIT, UCSF, Children's Oakland, back to UCSF, Berkeley for a master's in public health, and then a clinical associate professor, and then CEO of a company. How well is a 13-year-old going to do? She's like an eighth grader with a child. And what are the odds she's going to graduate high school, college, etc.? And certainly there have been women that have done it. Kudos. But so much harder. And so I was like, if we had only gotten to her before and said, hey, here's condoms and birth control. Are you doing this for love? Are you doing this out of pressure? You know, just the whole gamut, consent, enjoyment, pleasure, prevention. If we'd given her something to aspire for, so she would be like me, be like, no, I cannot get pregnant. I will make sure there's birth control everywhere because I want to be a doctor. I want to be president. I want to make money. I taught my girls, you know, you cannot have any kids until you have a partner, insurance, and a job, because you want the best world for your future child. And a best world ideally has at least two parents, if not more, because it's hard. And you want insurance and you want money to help have that beautiful life. I think everybody wants that for their child. And so I just knew that if I worked on access to confidential health care, sexuality education, and preventing unplanned pregnancy, such an easy thing. Just take a pill every day or have a shot every 12 weeks or throw an IUD up there that lasts for 7 years. Like, so many options. And you can have sex, just don't get pregnant or sexually transmitted diseases. Use a condom. And I have a condom bag, and people are like, ooh, married woman, why do you have condom bag, you player? And I was like, no, I don't like to leak someone else's secretions for the next 24 hours. And if my significant other had to leak my secretions, I'm pretty sure he'd be like, put a condom on it. I'm not going to leak for the next 24 hours, because anyone who's had to leak secretions, I run to the bathroom, I kegel it out, but still there's ooze, and it can mess up your vaginal microbiome. So condoms are a great thing, and know that there are different condoms, and I don't make any money, but condomdepot.com rates it from person who has a penis, person who has a vagina. Person with a penis gave it like an A-, person with a vagina gave it A+. And so at our clinic at Stanford, we try to have the best condoms with the best sensation, so you had greater adherence by the customer. So know that if you don't like the condom you have, go check out. There are other options that aren't more likely to break. They have good sensation. And I like the glow-in-the-dark ones. Those are fun, too.
Ooh, I didn't know there were glow-in-the-dark condoms. Well, that's a whole level of fun to explore. You know, one of the things that really strikes me about this conversation is that I think one of the real, from my perspective as a relationship and intimacy coach and an intimate marriage expert, that it's a really significant, long-lasting problem, of course, that some children never get any sex ed. That's a big problem, but that's not the thing I'm pointing to. The problem that I want to point to is that the vast majority, like over 90% of any kind of, I don't even want to call it a curriculum because it doesn't always meet the standard of curriculum. Sometimes it does, but regardless, the education that is available in the states that do offer sex ed in high school, their emphasis is essentially contraception and disease prevention without attention on pleasure, on how it feels, on how we might talk with our partner about what we're going to do or what we have just done. There's so many elements that flesh out making it a positive experience that you'd want more of. And so I tend to think, sex ed is just entirely inadequate across the board. But of course, focusing on pleasure and presence and all the things that I have my attention on is really entirely irrelevant if contraception and disease prevention isn't also handled. And I'm just reminded of the funny phenomenon. I'd heard of it and thought it was funny, but I personally experienced it. I don't know if you did, that one of the great things about sex while I was pregnant is that I didn't have to worry about getting pregnant while I was pregnant. Did you experience that too?
Yes, I think anybody with a uterus who doesn't want to be pregnant, or just like now is not the time, or just, you're fertile and you don't want to be pregnant most of your life, right? Like from age 12 to 50, that's like 38 odd years. You probably want to be pregnant 2 years out of that whole situation, maybe 4, now that 4 is the new 2, etc. But the rest of the time, you're like, no pregnancy, no pregnancy, no pregnancy. And even if you use the birth control pill, even if you use the pill plus condoms, even if you use the IUD plus condoms, it's a very, very low rate, but God forbid it's you, because then it's 100%. Even if it's 1 out of 1,000, if it's you, it's 100%. And I've heard women get pregnant on everything. There's some crazy fertile women out there. So just one tip, if you are the type that has your period every 28 days, you are the crazy fertile one. So please double up, meaning condoms plus an IUD or some hormonal method. Don't just go with the hormonal, because I've heard horror stories of, I was on the IUD, I was on the implant. The implant beats vasectomy, which tells you the vasectomy doesn't work all the time. And I just saw a TikTok from a great YouTuber I love. I'd love to give a shout out, but I forgot her name right now. And she was saying, I didn't realize you have to check the vasectomy. So you can't assume the vasectomy's worked until like you've checked the sperm count afterwards. So heads up on that one. But it also blows my mind, the implant.
Yeah, 6 weeks later.
Is it how many weeks?
I think it's 6 weeks, but you know what? I'm not talking as a doctor now because it's been too long and it was personal experience, so I don't remember exactly. So, but I mean, it's some amount of time because, the sperm is already in the scrotal sac, and that isn't impacted when you snip upstream. So all of that needs to be excreted. So anyway, let's get super practical, because of course there are many people who, it's actually kind of fascinating now in our current times, fascinating and awful, the whole range of reasons someone wouldn't have easy access to birth control, because there are people who live in states who have easy access, who have good health care, who have everything they need, and they are often too busy to prioritize it. And so your Pandia Health is going to be incredibly important for the woman who really is privileged in all of these ways, but just super busy, which it's easy to say, oh, come on, how busy. But people are incredibly busy these days. Then there are people who live in states where insurance doesn't require to have the insurance cover it. But then there's the ACA. Does that mean that there are people who have one kind of insurance through their Hobby Lobby employer, let's say in Oklahoma, and then they get additional coverage through federal programs? How does that work?
So most people have either federal because they don't make enough money to have insurance. And so know that there are Title X family planning clinics in every single state, and they are amazing in that they allow adolescents to consent regardless of what the state law is, because the federal law supersedes state in that clinic. But we unfortunately are not one of those providers, but they will cover anybody who doesn't have money or who doesn't have their insurance coverage for birth control, because it is in the interest of our country to cover them.
If somebody is in one of those states, do they just Google Title X in my state? And it tends to be the Roman, let's make this super practical for adolescents. So it's Title X. It's not TEN or 10. It's Title X. So you Google Title X in my state, and then almost like a safe house equivalent, that on that property, in that building, federal law applies. So you better finish your conversation before you leave the building, because if you call from home, well, no, they're still answering in there. But okay, that is great to know. And are there many Title X clinics? I've never heard of it personally.
Generally, Planned Parenthood is a Title X clinic because that's a great way for them to get funded. But there are also non-Planned Parenthood clinics. There are private clinics, also academic centers. Oftentimes, like any university nearby you is usually signed up if they're good people trying to take low income and trying to serve as many people as possible. The local county hospital oftentimes signs up. But if you're in a more conservative state, Planned Parenthood and Title 10, Power to Decide, I believe, has a birth control and abortion clinic finder, so those are good places. But for adolescents, know that the Title 10 clinics by law have to give you confidential reproductive health care. And then Pandia Health, in the states that allow adolescents to consent without parental consent, parental notification, the more liberal states, we allow adolescents to come. And so when they come, we're like, are you using this for birth control?
Come meaning call on the phone.
So, yes. Pandia Health is asynchronous telemedicine. So just go to pandiahealth.com, our website, and it just asks you questions, and it's all HIPAA compliant. It's all secure. We're not allowed to disclose your info unless you're in one of those states. And even then we're like, how old are you? What are you here for? No, we need your parents' consent if you're in Florida or Texas or one of the more conservative states. But if you're in the more liberal states, then we're like, oh, you're under 18. You have the right to confidential reproductive health care.
When someone wants birth control and wants access to the service that gets it, it's almost like one of those chat boxes on another website. In other words, someone's going to fill out the information and then hear back via email. So
not email, but our platform, but so because it has to be HIPAA compliant, and know that email and texting is not HIPAA compliant. Only if you download an app or you go to a secure website. And so we have a secure website, you log in, and only there do we send messages back and forth. We do text stuff that doesn't have HIPAA information, like, we have a message for you, please log in, or we need to follow up some questions, or things that just aren't HIPAA related we can ask you by text. But the way it works is you sign, we ask you 20 questions that have been approved by the state of California for pharmacists to write birth control, and then we added a bunch of doctor questions on top. The main thing you need is, if you have insurance and you want to bill it, then we need the front and back of your insurance. Generally, we like a driver's license if you have it. If you don't, then some sort of government school ID that has your photo and your name and ideally your birth date as well. And then a selfie to prove that you are who you are. And again, it's $30 once a year, which is, I think, a total steal. Unlimited questions. And we're in 17 major states, and we like to encourage birth control tourism. So, like, specifically, we are not in New Jersey or Connecticut because they have weird laws and it's harder to get into there. Eventually, we may get in there. But we are in New York. So if you could make it to New York once a year and be like, I'm in New York right now, then our New York doctor can be like, okay, and then we can ship it to all 50 states. Same thing goes for California, Florida, Texas.
So even with like a New Jersey home address on a driver's license, if you are filling out the form in New York, then you get New York services.
Yes. We ask, what state are you filling this out in? And so if you're in one of our 17 states that we have a doctor that's licensed to practice legally, then we can take care of you, and then we can ship it to all 50 states with our pharmacy partner.
Okay, amazing. And I don't want to cut it off because you were saying Texas, and let's go for whatever you were going to say about Texas.
Oh, yeah, because we're in the big states. So if you can get to the Disneys, if you're going to go to South by Southwest, if you're going to get to Vegas, we're in Nevada, we're in Arizona, we're in, I believe, Michigan. There's so many states that I've lost count of. Georgia, because we also went for swing states where we could register people to vote. And then, by the way, get your birth control. So check us out. Our website has all the 17 states, but it covers about 60% of the nation, and a lot of the states where a lot of people might vacation. So if you're going on spring break, or if you're going back home for Thanksgiving or wherever, if you're in a state we don't serve, check it out, or go visit a friend, or just cross the border if you're in a state that has a lot of states that border you.
Yeah, and I'm actually reminded of how MAD, Mothers Against Drunk Driving, works. Not the whole context or the story of the organization, but just that was a campaign. I don't know if it's still active, but it was a campaign for decades that really reached high school students. And I just have in my mind some kind of equivalent campaign around birth control that could either come from mothers or come from other teens. But I definitely want to say that if you're a teenager who's watching this, share Pandia Health or this interview, but just go for Pandia Health and share it with at least 2 friends and tell them to do the same. This is the kind of thing that people knowing is really the most important thing, because it sounds like you've worked out so many of the details to make it legal and medically safe and appropriate and inexpensive and logistically easy because it just comes in the mail. And really, I can see that based on what you've said, the main, I assume you have enough supply. So then the main barrier really is people knowing about it. So I want to invite absolutely anybody who watches this, be an ambassador for contraceptive health, because that creates babies when they're wanted and a lot more pleasure.
Yes. I wanted to say, what is your experience? I would think that those of us with uteri are less inhibited when we don't have to worry about getting pregnant, right? And so when I have a condom and some hormonal birth control, I'm like, the chances of pregnancy are very low. Let's just go. Let's enjoy each other. But if it's only the condom, what if the condom pops? Or, what if I didn't take my pill right, or blah, blah. But if we got 2 of them, then, we're double protected, and both sides are taking action to prevent unplanned pregnancy.
Absolutely. And when I was an adolescent in my early 20s, I really loved the idea of only having sex with someone that you would be willing to have a child with. It was not actually a standard that I adhered to personally, but I really liked the idea. And I remember, there are 2 really big kind of milestones for me in terms of relaxation and ease with sex and intimacy when my husband and I were clearly committed to one another, even before we were married and before we were engaged. But there was a level of commitment that brought relief. We were medical students. I was not wanting to get pregnant at that time. However, knowing that if I did, he would be the other parent just brought more ease and made sex more fun. And then I would say the next big jump with that, I'm 55 and I'm not menstruating. And I just was aware of how remarkable, even when I was menstruating my late 40s, but obviously not fertile anymore, it just opened up a certain kind of presence. It's like when you're trying to do something, but you have something in the back of your mind that you need to pay attention to, even though you can't, let's just say I needed to go grocery shopping to make sure I pick up salt. I'm just being completely mundane. And here we are having this conversation. I'm fully present, but I still have I don't actually need to buy salt, but I still have a little bit of attention on that. And whenever my mind wanders, that's what's going to come up. And I definitely think that because the more you can feel, the better the sex you're having. The more you can just put your intellect aside and have an embodied experience, then, of course, the more we can drop any kind of sympathetic concerns. I don't mean emotionally sympathetic. I mean the sympathetic nervous system that, to not have to worry. In other words, people might think, oh, the best thing to order online to have better sex is a sex toy. But no, the best thing to order online is some Pandia Health contraception in order to have better sex. And then if you want a sex toy too, well, fine. Enjoy some dessert, but that's really going to make the difference. So anything else that you want to say right now? We'll obviously include the link to Pandia Health in the show notes below.
Yeah, I just wanted to give a Pandia public service announcement. Can't let anybody leave without a new tidbit fact for the day. Know that there are 4 different types of emergency contraception. If the condom pops or, God forbid, somebody's sexually assaulted, I'm going to go from the most effective to least effective. Most effective is the copper IUD, 99.9999% effective. So if I or my daughter were sexually assaulted, I would be like, put in the copper IUD. I want a 0.0001% of being impregnated by this sexual assault. Next is the same category, hormonal IUD. You can actually stick that in and then leave it in, either of those, as long-term contraception. And that had like a 1 out of 312 people got pregnant on that compared to the copper IUD. Next is prescription emergency contraception, which a lot of people don't know about. It's called ELA. And again, thanks to the Affordable Care Act, no copay, no deductible if your doctor writes for it, free if you have insurance. And then third is Plan B, and it's generic. So if it were me, my daughter, my friend, anybody listening to this podcast, do you want what's third most effective? No, you want at least the second most effective, if not the first most. And then you want, lastly, you can take a bunch of pills now, a bunch of 12 hours. That does the least effective. Get all the other stuff if you can. And then think of it as a fire extinguisher. You want it sitting in the corner in case of emergencies. And at Pandia Health, we write in the prescription, please give her the one with the farthest expiration date. This is not for now. This is for future. And you can get one that expires in 2 years. And so if you don't have insurance, it's about $40 out of pocket, but that's better than pregnancy, better than abortion. And you could go in on it with a bunch of friends, one per dorm, one per sorority, one per group of 4 friends. $10 every 2 years is not too bad for emergency contraception. What's beautiful about the copper IUD is it works the same efficacy at preventing unplanned pregnancy for up to 5 days. After 5 days, all of these methods don't work. And for the pill versions, the longer you wait, the more likelihood of pregnancy. Because once the egg pops out, game over. And the way the pills work is they tell your body, she's pregnant, don't pop out another egg. And so if you wait, then the egg can pop out. And then once the egg pops out, there's really not much it can be done. But the copper IUD works the same up to 5 days out. So you have up to 5 days after contraceptive failure.
I'm just really grateful. This is a conversation that I think it's a treat to talk about in this way and have really be in the forefront of preventative medicine. It's much harder to talk about it if you're only finding out about this when you need it. So, and once again, if you're watching, share this with people who are not going to know this information unless you share it or they happen to come across it another way. So, Dr. Yen, thank you so much for being an ambassador of goodness for women, partners, and families.
Thank you so much, Dr. Stockwell, for making everybody's intimate life better.